while we're still learning about the health effects of coronavirus on kids, the serious risks for older people have been clear since the beginning, with experts and officials repeatedly warning that group to stay home.
This is like the angel of death for older individuals.
We are calling for the home isolation of all seniors in the state of California.
The new Safer at Home advisory instructs everyone to stay home unless they're headed to a newly opened facility or activity. And it also advises those over the age of 65 and those with underlying health conditions to stay home except for absolutely necessary trips.
In the first month or so of the outbreak here in the U.S., people over age 65 made up 80% of the country's COVID-19 deaths, or at least the ones we knew about, a number that's largely held steady, even as the country's death toll has risen dramatically. But there's much more to this picture that most of us have ignored. I'm joined now by Dr. Louise Aronson. She's professor of medicine at the University of California, San Francisco, and author of Elderhood, Redefining Aging, Transforming Medicine, Reimagining Life. Doctor, thanks so much for joining me. I appreciate it.
Nice to be here. Thank you.
So about a month or so ago, I read a piece you wrote in the New York Times, which stayed with me. You led it by quoting a headline from a news outlet's website, which read, "Not just old people, younger adults are also getting the coronavirus." Why'd you cite that headline, Doctor?
Because it suggested that the virus and the deaths from the virus, to say nothing of all the other harms, only mattered if they impacted younger people. That if old people die, it actually should worry most of us.
Well,
I could go on, but I said I could go on, but to me the problem with that seems obvious, but I'll let you.
Well, it is obvious, but I would take it a step even further. And my thesis at the beginning of this is one of the reasons why leaders were, and I use the term loosely, so willing to dismiss COVID-19 is because its primary impact was on older people and people with underlying conditions, people that they probably consciously or otherwise considered disposable. Is that an overreaction on my part?
I don't think so. And I think our response to the pandemic, even now several months in, continues to prove that case. We have known since the beginning, you just showed those incredible statistics, that most people who die are older, and actually rates of death, yes, it has to do with underlying conditions, but developing underlying conditions is something that happens to most of us as we get older. So the rate of death begins to go up in the 50s, it goes up a bit more in the 60s, it goes up significantly more in 170s, and then way up after age 80. Now, some people say, well, they're old anyway. Well, if you're a healthy 85-year-old, and particularly if you're a woman, but if you're a man or a woman, your life expectancy is 10 more years. So the fact that you died is not just that you were dying anyway. It's that you were killed by an epidemic. And yet, even as we're hearing that in most states, somewhere between a quarter to 70% of deaths are in older adults and in older adults who live in facilities, those facilities nationwide are still having trouble getting testing for coronavirus. They're having trouble getting adequate PPE to protect the workers and the residents. And they're just not getting, if you distributed resources proportional to need, they are not remotely getting what they need or deserve.
By the way, the numbers you picked strike close to home here. It's 71%, I believe, of the deaths in Rhode Island, and roughly 60% of the deaths in Massachusetts are in long-term care facilities. Yeah, I'd like to play you some sound that is also stuck with me. It actually occurred almost on the same day you wrote your piece in the New York Times. Here's the Lieutenant Governor of Texas, Dan Patrick, opining on this issue. Here he is.
No one reached out to me and said, as a senior citizen, are you willing to take a chance on your survival in exchange for keeping the America that all America loves for your children and grandchildren? And if that's the exchange, I'm all in. I just think there are lots of grandparents out there in this country like me. I want to, live smart and see through this, but I don't want the whole country to be sacrificed.
And there was another senior citizen, Bill O'Reilly, you may have heard of him, on with his former colleague, Sean Hannity. And O'Reilly said many people who are dying were, quote, on their last legs anyway. What's your reaction to the Lieutenant Governor and to O'Reilly there, Doctor?
Well, I think a few things. For the lieutenant governor, he's making a sort of false distinction. If we had done the right things, which have been done in other countries, ramping up testing, repurposing various factories and other places to make enough PPE, we wouldn't have to be making this choice. This was because of bad management, a lack of national leadership. Other countries have responded in ways that have protected citizens, and we have failed to do so. They're also putting all older people into a single category. One of the reasons I'd like to talk about elderhood is because it's an analogy to childhood and adulthood. If we had a situation where adults were dying, but they were all either in their 50s or in their 20s, we'd hear about that. If we had a situation where kids were dying and they were toddlers or teens, we'd hear the distinction. Yet at many health centers, they'll say people above age 60 are dying as if that's a single category. In fact, the rates go up with advancing age. And also, if we diminish people in any category and write them off, that is the beginning of a slippery slope in which most of us will be written off, if not now, then in the future.
I want to take another angle on this. I played you a sound from the governor of your state, the governor of my state, and I would more often than not say these leaders are well-intended. They want to protect the most vulnerable people, the most likely to have horrible consequences. But by protecting them, in many cases, as you know, they're sentencing them to long-term isolation. So how do you walk a fine line between protection and not putting lives at greater risk, older people, and all of the consequences that come from isolation?
Right. So we know the consequences of isolation are serious. They're akin to smoking most of your life. They lead to all sorts of diseases, hospitalization, and premature death. And I think early on in a pandemic, you respond to the viral threat. But we're now many months in, and I don't think we're doing enough to weigh the threats from our response to the pandemic against those of the pandemic itself. I also think that we again, have lumped all older adults into a single category, and we have deprived them of agency. So if you're 64 years old, you're allowed to decide how much risk you're taking. But if you're 66, you're advised not to, or, where you live could be guilty of elder abuse. So I think informed people in an environment made safe should be able to make their own decisions. And we have since the beginning allowed visitors to certain sorts of people, but we haven't allowed the sorts of visitors that would, at facilities, help decrease the stress on staff and provide better care.
I know of at least one country, and I'm sure you know of many more. One of the countries with the oldest populations in the world is Germany. And I'm sure you know better than I that Angela Merkel has gone out of her way to say we are not going to exclude older Germans from any reopening decisions. Is that a model for the United States? And how does she do that by not putting older people at risk, Doctor?
Well, I think you set up a society which, is happening in some states more so than in others, where it's possible to go about activities but with distance among people. You also make it safe for people to just do basic things like go for walks or get groceries. In groceries, they're doing, at grocery stores in California, we've got pretty good social distancing. What I really saw fall off this weekend was people wearing masks. It wasn't everybody, but particularly it was young, healthy, one might say privileged-looking younger people. And I think unless you really have never had a parent, grandparent, teacher, mentor, or friend that was over 60 that had any value to you, then consider wearing a mask not just for yourself, but for your future self and anyone you've ever loved that was over age 60, because that would allow people to go out. They would be protected.
We don't have time to talk about the obvious, but let me just state it. Obviously, there are a lot of people over 65 who are still working or are still looking for work. I looked up the numbers today, which I'm sure you know. People over 65 are the least likely to be able to work from home, so that the economic consequences as well. But I want to end with you, is that in virtually every nightmare part of this pandemic, people with whom I've spoken have said, well, we can come out of the other side having learned something that may put us in a better place. I know in the middle of this, I think you may have written about this, that Medicare was allowing coverage for telehealth visits for people on Medicare, which obviously is an advance and important. Do you see other good things? I don't mean pipe dream stuff. I mean realistic good things about our relationship with and respect for senior citizens of this country coming out of this pandemic?
I certainly hope so. I think there has been enough outrage and sympathy for people in long-term care facilities. And let me just say that 92% of older adults live in our communities. So in some ways, the focus on these places is increasing the distorted notion that all older people live in skilled nursing facilities. They do not. But I think we're all realizing that if the job of taking care of people when they're old and frail is so hard that we're not willing to do it ourselves, we need to have it done by people who are adequately paid, and that it shouldn't be a for-profit industry with a huge lobbying arm, which allows them basically to have such small penalties that the places where people are dying in huge numbers are places we have known were bad actors for decades, and they are almost exclusively for-profit places that decrease staffing in order to increase their profits. But at the cost of, if you need to take care of lots of people, you're going to bring contagion from one to the next. We know which laws will protect lives, and we could pass them with ease. So we could all be a part of lobbying for them.
Dr. Aronson, from your lips, hopefully, to some powerful people's ears, thank you so much for your time.
Some powerful senior citizens' ears.
Indeed.
Running our government,
Dr. Aronson, hope to talk to you again soon. Thanks so much.
Thank you.